Changes in estrogen levels have a pronounced effect on women's lives, but men can have issues with estrogen as well. Today we asked Dr. Jenny Wilkins from AgeVital Pharmacy about estrogen dominance in both men and women. Welcome, Dr. Jenny.
Thank you.
All right, estrogen dominance sent shivers through the men on the set here.
I know.
They think that's when women are in charge, but that's not exactly what it is.
I was like, oh my God.
Tell us about estrogen dominance.
And on my social media, sometimes I'll do the 7 dwarfs of estrogen dominance, you know, like the PMS, the itchy bitchy, you know? It's like, is this you? And
That's very funny.
Gosh. It's
so
like,
what does it mean,
happy,
though?
sad, emotional, cranky, want to stab somebody, you know? That's estrogen dominance. And it happens in both men and in women. And it's something, yeah, a lot of our foods are causing people in our society to be estrogen dominant. Even little kids can sometimes suffer from high estrogen. So the #1 thing that I tell about people is change your diet. So change your diet meaning avoid high soy, because soy will convert into estrogen.
Soy? I didn't know that. I'm going to write that down.
So you see soy lecithin in pretty much all the food products. And this is the big increase of, you see a big increase in breast cancer in women, and then 10% of the breast cancer cases right now are in men. That should not be happening, especially in guys, because guys are all testosterone. But then, you know, if we're having all that estrogen in our foods, being pumped in our foods, xenoestrogens, phytoestrogens, so meaning the toxins in our environment, even from like pesticides, microwaves, with the plastics, you know, that's huge. Avoid things like that.
So it's out there.
It's out there.
It's out there. Let's take a look at how people know if they could possibly have an increase in estrogen in their symptoms. So tell us about the women.
The first thing you want to ask them, are you having bloating? Are you gaining weight? Are your breasts tender? Do you have irregular menstrual cycles? That's huge. So infertility with estrogen dominance, if somebody has irregular menstrual cycles, headaches and mood swings, big time for women, insomnia, and then really, really low energy. So
now these also sound like PMS lists too.
Yeah,
like how do you know the difference? That's PMS. That would be once a month.
PMS is one of those symptoms. That's why women, when they PMS, it's because, you know, they have too much estrogen during that time of their month. So they're releasing, you know, so much estrogen, progesterone levels drop, estrogen levels go through the roof. So it's all about ratios with hormones.
So if you feel like that all of the time, then you may have some hormones.
You're deficient in progesterone.
Okay.
Yep, and then both men and women can take progesterone, you know, capsules, troches, injections, and then also support their system, you know, nutritionally. Like the lipomino injections, very good to flush out, you know, excess estrogen in the body, because it helps protect the cells. So a deficiency in B12 is, you know, it can counterbalance that. Yep, but progesterone, I also have a product called Aroma Dim, which is an amino acid. People take that, both my men and my women, and then they're supporting their metabolics by getting rid of all the excess estrogen in the environment. So that specific capsule that I sell, just, you know, because I have men, bodybuilders come in and be like,
let's talk about men. So then the list of what men
guys think
can
it's
suffer.
just the women. I'm like, no, if you have no libido, it's typically, you know, too much estrogen in their body. If they have breast male enlargement, that's called gynecomastia, the breast tissue, you see a lot of the older men get, you know, enlarged breast tissue where they look like they're getting boobs because the progesterone levels drop. Then they end up getting the prostate cancer because the estrogen is too high. So remember, estrogen helps your tissue to grow. So if you have it in there for a longer period of time than when it's supposed to be in there, you're going to get, you know, the polycystic ovarian syndrome. You can get breast cancer. You can get swollen prostate.
So it's more than just not feeling good. I mean, there are serious health problems that can result.
And then the progesterone counterbalances that. So it's all about balance with the hormone therapy.
And hormone levels can be checked.
And they can be checked. It's to test estrogen. It's like $45. You do a simple saliva test kit, and then to test progesterone and estrogen ratios, you know, it's around $90 to $100.
All right.
Super simple. Most insurances cover it too.
Sounds very simple and very necessary in terms of happiness and health prevention. So thank you, Dr. Jenny.
We
always
don't want
learn
men
things.
PMSing.
No,
we don't want that.
I like your crusade to cut down PMS in both sexes. This is a good thing. All right, you can visit Dr. Jenny at AgeVital Pharmacy in downtown Sarasota on Main Street, or of course you can find her online at AgeVital.com. When we come back, Cliff's gonna wrap up a very busy social season. We can't wait to hear the behind-the-scenes talk.